Okay, so today we're doing a deep dive into something pretty important, and that's stroke risk, specifically for people who have atrial fibrillation.
Ah, yes, atrial fibrillation.
Right, which, for people who might not be super familiar, it's basically a heart rhythm problem that can actually increase the chances of blood clots forming.
Yeah.
And those clots, well, they can lead to some serious issues, like a stroke. So to navigate all this, doctors use these scoring systems. There's the CHA₂DS₂-VASc score and the ORBIT score, and they're really all about helping doctors figure out, okay, who needs treatment to prevent those clots from happening in the first place.
Exactly. They're really valuable tools, I think. Tools that can help guide those decisions about preventing stroke in folks with AFib.
Right. Because it's a bit of a balancing act in preventing the clots, but also not, increasing the risk of other complications from the treatments themselves. So before we jump into the nitty gritty of these scores, though, can we maybe rewind a bit and just make sure everyone's on the same page?
Yep.
What exactly is atrial fibrillation, and how does it directly connect to this whole stroke risk thing?
Yeah, so atrial fibrillation, or AFib, like a lot of people call it, it's basically when the heart's upper chambers, they're not beating in that nice regular rhythm that they should be. It's more like they're kind of quivering instead of beating effectively.
Quivering, huh? So not like a nice steady beat.
No, not at all. More like a chaotic kind of rhythm, which, it can lead to blood pooling in the heart. And when that happens, that's when you start to see clots forming. And if a clot breaks free and travels to the brain, well, that can block blood flow, and that's what causes a stroke.
Oh, okay. So it's like the irregular heartbeat creates this opportunity for the blood to kind of, get sluggish and sticky. And then that's where the clots come from.
Precisely. And those clots can then cause a lot of trouble if they travel to the wrong place.
Right. Okay. So I've got these two scoring systems, CHA₂DS₂-VASc and ORBIT. And I've got to admit, the names themselves are a bit intimidating. CHA₂DS₂-VASc sounds like some kind of, complex algebraic formula.
It's a bit of a mouthful, I'll grant you that. But the good news is it's actually pretty straightforward once you break it down. So each letter in CHA₂DS₂-VASc stands for a specific risk factor that we look at to kind of gauge a person's stroke risk.
Okay. So it's like a mnemonic device almost. So let's break it down then. What does the C stand for?
So the C stands for congestive heart failure.
All right, congestive heart failure, got it. And H.
The H is for hypertension, which is just a fancy way of saying high blood pressure.
High blood pressure, yeah.
Yeah.
Okay, and then the A.
Now, the first A stands for age 75 or older. And this one's interesting because it actually gets 2 points. Being older puts you at a higher risk of stroke.
Oh, so like a double whammy, just for having more birthdays.
Well, age is a significant factor in many health conditions, unfortunately.
Yeah, that's true. All right, so what about the rest of the acronym? We've got DSV, another A, and then SC.
You got it. So the D is for diabetes mellitus.
Diabetes, okay.
The S stands for a previous stroke, or TIA, which is short for transient ischemic attack. You might have also heard it called a mini stroke. And this one, like age 75 or older, also gets 2 points.
So if you've already had a stroke or even a mini stroke, you're automatically considered higher risk. That makes sense.
It does, doesn't it? Next, we have V for vascular disease, and that can include things like a previous heart attack, peripheral artery disease, or even plaque buildup in the aorta.
So basically any problems with your blood vessels. Okay, got it.
Exactly. And then the second A is for age 65 to 74, which gets 1 point.
So age is really a big factor here.
It definitely plays a role. And finally, the SC stands for sex category, with females getting 1 point.
Okay, interesting. Is there a reason why being female would increase your risk?
Well, from what we've seen in the data, women with AFib do tend to have a slightly higher risk of stroke compared to men. There are probably multiple reasons for that, like hormonal differences or even just variations in how atrial fibrillation presents in women. But we need more research to really pinpoint exactly why that is.
So more to uncover there.
Yeah.
But for now, we know it is a factor.
Exactly.
Okay, so to recap, CHA₂DS₂-VASc, we're looking at congestive heart failure, hypertension, age, diabetes, history of stroke or TIA, vascular disease, and sex category. Did I get them all?
You got them all.
Awesome. And the higher the total score, the higher your risk of stroke. So this score basically helps doctors decide if someone needs to be on blood thinners to help prevent a stroke, right?
Precisely. It's all about weighing the benefits of taking a blood thinner against the potential risks. So, for example, the UK's National Institute for Health and Care Excellence has guidelines based on the CHA₂DS₂-VASc score. Generally, they don't recommend stroke prevention therapy for men under 65 with a score of 0 or women under 65 with a score of 1. But for men with a score of 1, doctors might consider prescribing anticoagulants, which is what we call blood thinners.
Okay, so there's some nuance there based on sex and age.
Right. And for anyone with a score of 2 or higher, anticoagulation is usually recommended.
So it's like the higher the score, the more likely you are to be prescribed blood thinners to help prevent a stroke.
That's the general idea, yeah. But of course, it's not just about preventing stroke. We also need to be mindful of the bleeding risk that can come with taking blood thinners.
Right, because those can have their own set of complications.
Exactly. And that's where our second scoring system, the ORBIT score, comes into play.
ORBIT. So we've talked about how to assess the risk of stroke, but now it's like, okay, what about the other side of the coin? How do doctors determine if someone's likely to have bleeding issues, especially if they're on blood thinners?
Well, the ORBIT score helps us figure that out. So want to break down this acronym too?
Yeah, let's do it. Always up for a good acronym breakdown. What's the O stand for?
Right. So the O stands for older, meaning 75 years or older, which, as we saw at the other score, age is a factor. So that gets 1 point.
Okay, 1 point for being 75 or older.
Right. The R is for reduced hemoglobin or a history of anemia, and that one gets 2 points.
Hold on a sec. How does that relate to bleeding risk?
Good question. So if you have low hemoglobin, it basically means you have fewer red blood cells, which can make you more prone to bleeding.
Oh, okay.
Yeah.
So if you don't have enough healthy red blood cells, you could be more likely to bleed. Makes sense.
Makes sense, yeah. The B is pretty straightforward. It stands for bleeding history. So if someone's had significant bleeding problems in the past, they would get 2 points for that.
Okay, so past bleeding issues are a red flag, so to speak.
Right. The I stands for insufficient kidney function, which gets 1 point. And we measure kidney function using something called eGFR, which stands for estimated glomerular filtration rate. And basically, a lower eGFR means that the kidneys aren't working as well as they should be.
Oh, so kidney problems can also up your risk of bleeding. That's interesting. What about the T?
The T is for treatment with an antiplatelet agent, and that gets 1 point. And antiplatelet agents are basically medications that help prevent blood clots, but can also, as a side effect, sometimes increase the risk of bleeding. So aspirin's a common example of an antiplatelet agent.
Oh yeah, aspirin. So it's like if you're already on something that's thinning your blood, like aspirin, and then you need to take a stronger blood thinner for atrial fibrillation, you might be at an even higher risk for bleeding.
Exactly. It all adds up. And just like with the CHA₂DS₂-VASc score, each of those orbit factors gets a certain number of points. And then we add them up. A score of 0 to 2 is considered low risk, a score of 3 is medium risk, and then a score of 4 to 7 puts someone in the high risk category for bleeding.
Okay, so it sounds like doctors are basically using these two scores, CHA₂DS₂-VASc and ORBIT, almost like a balancing scale.
Yeah, I like that analogy.
Like on one side, you've got the risk of stroke, and on the other side, you've got the risk of bleeding.
Yeah.
And they're trying to find that sweet spot where they can prevent a stroke without causing too much bleeding.
That's a really good way to put it. They're valuable tools to help guide those decisions. But of course, every patient is different, and these scores are just one piece of the puzzle. You know, there are other factors that doctors take into account, like the patient's individual preferences, their overall health, lifestyle factors. It's really a conversation that people should have with their doctor to determine the best course of treatment for them.
Right. It's not just about plugging numbers into a formula and getting an answer. It's about like personalized medicine, really considering the whole person.
Absolutely.
So just to recap for everyone listening, CHA₂DS₂-VASc score helps us understand the risk of stroke if you have atrial fibrillation, and the ORBIT score helps us figure out the risk of bleeding, especially if you need to be on blood thinners.
Exactly.
Now, here's something I think would be interesting for everyone to kind of think about as we wrap up. So we talked about these scoring systems, but what other factors, beyond just the scores themselves, might a doctor consider when making decisions about treatment?
That's a great question, and I think that's where the individual patient comes in. You know, what's their lifestyle like? Do they have other medical conditions? What are their values and preferences when it comes to medical care? All those things play a role. It's about finding the best approach for that particular person, not a one-size-fits-all approach.
Right. Shared decision-making. I like that. Well, hopefully this deep dive has, cleared up some of the mystery surrounding stroke risk and atrial fibrillation.
I hope so, too.
And for everyone listening, thanks for joining us for another deep dive. We'll catch you next time.